This is not live. It's live recording. This is not live, people. Um, hey, hello, everybody. Here's your Bike Fit team, right? You have Brian, Anthony, Lori, and we thought maybe it would be a good idea to kind of start this kind of just fitter roundtable that we can pop up every once in a while and start talking about topics. So if there's topics that you have that you want us to kind of touch on, feel free to throw them in the comments or just reach out to us. Like, we're always looking for ideas, obviously, to talk about, and we'll talk about anything because we were for about the last 30 minutes. So luckily we did not hit record because I don't think any of it would actually apply to what we want to get into.
But on the cutting room floor.
Exactly right. Maybe I'll have on Anthony's blooper reel at some point.
Yeah, I'm always good for those.
But what we kind of thought about touching base on today, because majority of the people in the Facebook group and the bike fitting have probably experienced a bike fit already, right? So we don't want to just get into like how wide a saddle should be and stuff like that. So we were kind of kicking around the idea of talking about some of the limitations we come across, that we see in our clients and what makes us individuals, right? Those limitations are what make us each individual and why each of us needs a different bike fit. And I just wanted to start it because what I had learned in school through biomechanics was that we kind of classify limitations or constraints in three different ways, right? We look at cognitive constraints, right? Is it something in our head that's kind of stopping us from being able to do something, right? Is that what we're going to deal with in a bike fit? Maybe sometimes it's a belief or just knowledge, right? I don't know I'm supposed to drive my heel until someone tells you you're supposed to drive your heel. You have environmental constraints. That would be the bike itself. If you're 4'11", is that bike set up for you? Like that crank arm we talk about all the time, that crank arm can't move. We can't make it bigger or shorter. So that's an environmental constraint that we might have to work around. And then what we're going to get into today a little bit more would be morphological constraint. And that's your body. Is there something in your body that's limiting your range of motion or your ability to perform an action? And how does that affect your bike fit and how you operate? Because the fact of the matter is, you're not going to throw your bike away, right? Everybody should ride a bike. Doesn't matter what kind of constraints you have, the bike can be used. It's just a matter of figuring out how you need to use it compared to how I would use it or Lori would use it. I'm not sure Anthony uses the bike, so I'm not going to say him. He's got one hanging on his wall, but so let's just kind of throw it out there. Lori, you had mentioned something that you kind of ran into recently. You even mentioned it on the talk with Greg the other day about the ankles. You want to kind of just jump into that?
Sure. So I had a client who had a surgical fusion on his ankle, which obviously limits the ability to go into flexion and extension, right? So we don't have that same range of motion at the ankle. And that's that first chain of connection to the pedal to get the power up into the saddle. So what is that going to limit? And we had to get a little creative because it's creating basically functionally a leg length discrepancy there. So we don't have that same range of motion on one side and then the other side. And that's a great challenge for us, again, because we can't change the bike itself. It's not like I'm going to put one crank length on one side and one on the other. I could make a change in cleat position, which actually can change that differential. Really had to look at how we could pedal effectively with the fore aft of the saddle. That was what it came down to. So how have you guys handled things like that in the past?
I mean, the things that I see the most of are spinal fusions. Usually like, L5, S1, that's kind of the, it's almost always like all of those, Mm-hmm. And what makes that a challenge is that, like, because those vertebrae are fused, they can hop on the bike and their form, like, right off the bat looks awesome, because their back is nice and flat. But that there's something, there's something that's forcing that into place. So, the question that, the fitter has to ask him or herself is like, is it actually their form is awesome, or is it just the fusions that are causing that, And looking into the higher areas of the spine, that's usually where the telltales are. Are the shoulders pushed back? Are they kind of rolled forward, and just kind of using the upper back. But yeah, that's always an interesting one because it's just like, the spine is fused, right? They hop on the bike. It's like, oh man, your back is perfect, but there's another thing involved, so that's probably what I see the most of is just lower back.
So when there's a spinal fusion in the lumbar spine, we see compensation in the thoracic or the cervical spine.
Pretty much, yeah. So you can kind of sometimes when things are pretty awry, you can kind of see where the fusions end, and then everything else is just like super kyphosis or something like that.
Right. And what is kyphosis?
Kyphosis being kind of a rolling forward of the shoulders, kind of a hunchback, if you will, but yeah, that's definitely how I do it. I'm sure there's people on the inter-Google highway who would disagree with that, but hey, as long as the rider's comfortable and happy, that's what we're here to accomplish.
Yeah, it's funny. Like those two, like I'm looking at what the commonalities of those two things are, right? It's fusion. It's a lack of mobility. Right. And something I've always tried to keep in the back of my head is when there's a lack of mobility in a joint, the joint above and below are going to have to take over for that range of motion, right? Because that range of motion is going to have to happen. So if I don't have that ability to flex or extend my ankle, what's happening at my knee, right? Or my toes, my arch, all those things.
Although in a cycling shoe, which is firm, that's somewhat changes that ability
if the cycling shoe is firm, right? So that gets into kind of like that whole importance of the actual cycling shoe and the platform, because some of those shoes that athletes are using are not a stiff
very
sole
flexy
bottom.
Yeah.
So someone like that, like that's an important conversation to have, and making sure that the proper shoe is being worn, right? Or the proper support in the bottom of the shoe, in the arch or up in that metatarsal area, because is he trying to compensate inside the shoe for the lack of ankle mobility or something along that lines?
Well, and what was interesting about this client is he did change to a flexi shoe, which allowed him to compensate, but maybe that's going to lead to something down the line.
That would be my concern.
Yeah.
Is that compensation is
that's a
going
very
to
good thought.
lead to something down the line that he's going to have with a plantar fasciitis or something along that lines.
Oh, and that was it. He also did have PF. So
into that area, or what's happening at the knee. Yeah, I would have loved to seen that too, because in my head, I'm also thinking of like, okay, well, having a stiff ankle is not a bad thing in cycling.
No, but when it's really stiff.
Yes, to a point, right? Like we do want to limit that ankle mobility a little bit, because we're really trying to transfer power through the ankle, not generate power through the ankle. But I could see how the top of the pedal stroke in particular would be super, super tough, right? Like that knee coming up a little bit higher or not being able to get that foot position. And then same thing with like that spinal aspect, right? Like the ability to limit the lumbar spine is going to affect that thoracic spine, right? They're going to be more hypermobile in that area, and that's going to affect handlebar height for sure, right? 100%. And then what's the ironic part is the thing I kind of came to the table with was the opposite of that. It was almost hypermobility, right? I had a client that had I always forget how to say it.
Diastasis recti.
Diastasis recti, yes.
Stasis recti.
Stasis, yes. There's like 3 different ways to pronounce the thing. Whatever. Google it. And it's an issue that can affect both males and females. I think it's more common in females, especially postpartum and things of that nature, when essentially what's happening is that the abdominal muscles kind of pulling away from the midline of the body, right? So we don't have as much control over our pelvis at that point in time. And we all talk about in our fits about how important pelvic stability is in cycling. So to have something that's limiting that stability, or just a weakness in the core that we see sometimes, was interesting for me. And we do come across this, and sometimes it's more extreme than others. And this was, I thought, a pretty extreme example of it. She had a really hard time maintaining pelvic stability on the bike. And one of the things that we are constantly saying is about how to get your pelvis to rotate forward a little bit, right? To get that nice flat back, to not slouch in your chair, to rotate that pelvis forward. And this client was having the opposite problem. They were rotating too far forward. The abdominal wasn't able to kind of help control that. And it was kind of just falling forward into this kind of huge arch in the low back, which is equally as bad as having the slouch, right? So something I had to think about was, one of the cues I constantly use is to control the pelvis is to control the shoulders, and vice versa, right? Pull your shoulders back, your pelvis rotates forward. Push your shoulders forward, your pelvis rotates backwards and starts to slouch. So I'm constantly telling people shoulders back, shoulders back, shoulders back. But for this client, it was like, well, no, I actually need you to push into the handlebars a little bit to actually bring these shoulders forward a little and use your upper body to help control that pelvis area. That was a.
And the challenge with that is, how do you use the upper body to control without then putting too much stress on the upper body, right? So there's a very fine line there. Did you suggest any off the bike work? I'm just thinking right now of, perhaps you said her squat was beautiful, that she had a beautiful deep squat. What if she did the same thing while she was squatting and pushed back on a chair or a counter or that kind of thing? Would that help her train that muscle activation?
It wouldn't hurt. Hurt. We didn't get into too much off the bike. She was seeing PT, so getting professional help for the thing. And, I always say whenever I'm doing the movement assessment, this is not diagnostic, right? I'm not looking to fix something here. It's Zoom, it's FaceTime. I can only see so much. And, to bring in other professionals, that's the thing, right? Like that's their key. So definitely clients going down the right path for sure.
Yeah.
But I think it's more about having the cue of understanding what to do while you're on the bike, right? Like I was always one of those big believers of, if we need to engage something while you're doing something, then you need to practice it while you're doing it, not while you're not doing it. So, walking away with that homework of before every work interval, you're about to get ready to work, get into your position. And typically I would say to people, shoulders back, pelvis forward, heels down, and then drive the heel, drive the heel, drive the heel.
Right.
Well, for this client, it was a little bit different. What are those cues? It was control posture, not just shoulders back. It was a little press, a little bit maybe more pressure in your hands than what we would be accustomed to, right? So they needed that. So it was what's the cues that she needed to set up for her interval. And then after the interval, always relax, right? Like sit up, move around, change position, get back into it. But
it's a good example of practicing something in a low stress situation. And I try to emphasize that whether we're indoors or outdoors. Is I don't go to the top of a 10-mile descent with an 8% grade and try to descend in my drops without touching my brakes. I'm going to go to a flat parking lot and learn how to countersteer an emergency stop, right? So I'm going to progress. And same thing there. Take that low risk situation, the break, the recovery time when I can reset and get my posture ready to go again. So it was good.
Yeah.
What was the differential between saddle and bar for her? Did you find it had to be higher than normal or lower than normal?
Ironically, it's funny. Like that's what we actually lowered her bar.
Yeah.
Yeah. We actually had to lower the handlebar because that was super important, right? Because when the handlebars were a little bit on the high side, what it was literally doing was pushing her shoulders back, right? Which was forcing that shoulders back, which was forcing this huge arch. So by lowering the handlebars, it was allowing the front to kind of drop into it. So yeah, we actually had to lower the handlebars a bit to get a better posture.
Right. Well, good. Have you gotten feedback from her yet after her fit?
It was recent, so
okay. It'll be interesting to see.
Looking forward to hearing it. I mean, immediate response was great, right?
Yeah.
Felt more pressure into the feet, felt better engagement through. As we would expect with a more stable pelvis, right? That's what.
So let me ask you one more question. So we talk about pelvic stability and pelvic instability. How do we know? How would a rider know if they're stable at the pelvis or not? What do we think?
Anthony?
Well, I mean, one of the things that I do that, I was kind of taught to do years ago and still do is kind of a 1/3 knee bend, in the pre-fit. So, and watching the hips, watching what they do. Do they stay level as the rider goes down and come back up? Does one hip dip? That kind of stuff. And what's kind of cool is like the vast majority of riders have fairly good pelvic stability. You see those hips stay nice and level coming down and come back up. But every once in a while you see something like, whoa, it kind of looks like a wave as it comes down and go back up. So, I mean, that's how I tell. But I mean, how do you guys do it?
Yeah, I I'm always thinking about it on the bike. I'm practical, right? So for me, it's always, if you can do something off the bike, can you do it on the bike? Like to me, they're separate things. Like I view a squat differently than I view cycling. So if you can do one place doesn't mean you can do it the other, or vice versa. So I've always been that way. Right. That's just kind of my view on always. This is always like, all right, I want to see what you can do on the thing itself. So for me, when I talk about pelvic stability or think about pelvic stability, it's how stable are they on the bike itself? Right. What's that pelvis motion look like when they're on the bike? And that's 3-dimensional, right? Are they getting a side to side rock, reaching for that pedal stroke? Are they rotating in that manner, or are they rotating forward and backwards? Are there any of these kind of movements happening? And cycling is about the pelvis. That's our base of support, right? Our foot is moving from our pelvis. If I was on the ground is solid, right? Like my foot is pushing that, my pelvis is moving up and down. Your pelvis needs to stay stable, and that ground needs to move in cycling. So I always say is like, you don't want to jump off a floating dock because you're not going to jump very far, right? Or you can't shoot a canoe. You can't shoot a cannonball from a canoe. Right. It's the same idea. If your foot's that cannonball, your pelvis cannot be a canoe, right? It needs to be nice and stable. So for me, Lori, I'm looking at it while they're on the bike and how much motion is happening there. And, I wish I could watch them for 45 minutes straight through a whole class, because how it looks the first 5 minutes and how it looks the last 5 minutes are probably big difference.
And it varies, everyone has their preferred cadence, their preferred resistance, and it varies throughout a class. I did a class just this morning with Matt, and I was dreading it because it was an all zone 2 ride. Snoozer. But he did some really interesting things with a combination of cadence and resistance and standing and seated. And I find the lighter resistance when we're trying to keep a low cadence is really, really hard for me, because that's not how we ride outside. When I'm climbing outside, I have heavy resistance at that low cadence. And when instructors have us with light resistance at a low cadence, I feel like I don't have stability. And so I have to really, really focus in on that. Yeah. And I think everybody's, is it?
It is, because I also grew up riding track bikes, which are fixed geared bikes. And riding a fixed geared bike indoors, which
at a range of cadence
is a range of cadence, is the high cadence is very difficult, because every time the pedal's coming up, it's lifting you.
Yeah.
Right. Yeah. So that instability now comes into is how do you control the top of that pedal stroke? It's about how
we do it with resistance, because you have a range of resistance on the Peloton. It's not just a fixed gear. I mean, it's fixed, but it has gearing versus a track bike that is single speed.
As you increase your cadence on that bike, on the Peloton, the resistance is lowering, right? Because you're gaining momentum in the flywheel.
Correct.
So unless you're reaching down and adding resistance as you increase your cadence, you're reducing the resistance.
Correct.
Which is what's causing that bounce. I would say 9 out of 10.
And I think that's also one of the so beside the fact that we're not watching someone at a variety of efforts typically, although we should be doing that in our technique analysis. But I think the other challenge is, as you said, this is a 3D visualization. I have a hard time sometimes with video. I'm looking at just one thing. And sometimes I will ask someone to move the camera if we can do that. So I can see them from the front, or I can see them from the back, or even from the other side if we know that we have some kind of differential there. But it's definitely a limitation to the kind of fit that we're doing on video. So.
All right. So we could keep talking about this for probably about 4 hours.
The clock is counting down. I guess what it comes down to is like, we have all been given the book, right? Like, there's the bike fitting book.
I wrote the book. What are you talking about? Just kidding. Just kidding.
But, the point being is there's the set of guidelines that we were given, back in the day when we first started doing this. But, what, at least speaking for myself, what I've learned over the years is like, there are every once in a while a time when you can go by the book. Like you have that perfect case scenario where you're seeing all that stuff, but probably 7 times out of 10, you're chucking that book out the window. It just doesn't apply to what you're seeing in front of you. So, that's kind of the takeaway that I get from this is like,
Well, and I think from a biomechanical point of view, it's one of the reasons why we look at ranges versus absolutes. right?
Yeah.
So we know that there are ranges that are going to be comfortable and powerful and a combination of the two. And maybe I sacrifice some power because I want comfort, and maybe the other way around, depending on what kind of riding I'm doing. But yeah, I think it's very true. And I think folks will often on Facebook, we know, say, hey, I'm 5'10". What are your settings? You're 5'10", and you will almost never find two people that are at the same settings. It would be very interesting to me actually to take all the data of the thousands and thousands of people we fit and see if there's any correlation there. I would highly doubt there's even two people at the same position because we all have differences.
Yeah, I would agree. I think
Yeah,
you could take identical twins,
right.
and they're not going to be set up the same way on the bike.
Yeah,
And that's because of connective tissue, tightnesses, mobility,
history, injuries,
history,
all kinds of
even sport history of just comfort, right?
Yeah.
And again, these get into all these different constraints that we talked about, cognitive and morphological. Morphological is not just your bone; it's your muscle connectivity. You know, how tightness of your muscles are you, your range of motion. Cognitive is your experiences, right? Did you grow up riding a bike? Did you not grow up riding a bike? Did you grow up being athletic or sedentary? You know, things like that. Like those are all going to affect how you ride the bike and how you use the bike as well.
Yeah.
Like, do you even like the same classes, and are you trying to do the same thing? Are you riding your bike for the Pelofondo, or are you all about doing hits classes, right?
Yeah.
Those are two different positions if that's what your goal really is. So yeah, I think the biggest takeaway here is like your bike fit is individual to you. It's not individual to a size.
Yeah.
Yep. And anytime you hear somebody using absolutes, like everyone should do this, steer clear.
Yeah.
Yeah.
Awesome.
Anyway.
Well, this was fun. And I would say if any of our viewers have some feedback or questions or ask me anything that they'd like to see addressed in the future, this would be a good time to drop a comment.
Yeah, let us know
Awesome,
what
guys.
you want us to talk about.
Awesome. Well, let's wrap it up.
Peace out, y'all.
Later on. All right, bye.
And
I
cut.
stopped it.